Well, good evening, everyone, and welcome. Thank you all so much for joining us for tonight's important public lecture, Facts and Fictions about Vaccinations, Protecting Our Children, Ourselves, Our Families, and Our Communities. Our goal this evening is to take an open and thoughtful look at the role of vaccines in promoting both individual and community health. We'll explore the evidence, the solid scientific foundation behind vaccines, but we'll also recognize that people come to this topic with different experiences, different values, and different perspectives. This is not a program about judgment or blame. It is a program about understanding. We hope to create a supportive, inquisitive space, a space where we all share a very real and important common ground. We all very much care about the health of our families, our friends, and our community. Although people may hold different opinions or even level of confidence about vaccines, everyone deserves the same respect and the same opportunity to ask honest questions and hear honest answers. In just a minute, I will have the great pleasure of introducing three outstanding speakers who will each bring their own unique perspective to this important conversation. But first, let me briefly introduce myself. My name is Dr. Jim Hornstein. I've been a practicing primary care physician in Ventura County for over 35 years. And I currently serve as the chairman of the bioethics committees, both at Community Memorial Healthcare, in addition to Ojai Community Hospital, the Ventura County Medical Center, and the Ethics Committee at Santa Paula Community Hospital. It is truly my pleasure to welcome all of you here today. And now let me give you a brief overview of who our speakers are and what they will be covering. Our first speaker this evening is our county public health officer, who will discuss what vaccines actually do, how they protect our community, and what happens when vaccination coverage drops. Next, we'll hear from a local pediatrician who will not only share her professional experience with vaccines, but also her personal experience as a parent, caring for her child and building trust with communities and also in families within our communities. And finally, we'll welcome the Director of School Nursing and Compliance from the Ventura County Office of Education, who will speak about how vaccinations support safe and healthy schools, places where our children can thrive, can learn, and can help strengthen the well-being not only of their individual schools, but of our entire community. Following their formal remarks, we will have a question and answer session. Those joining online, welcome, and you can submit your questions through the chat. And those who are here in person can write them down on cards which you'll have in front of you or also on the chat. We will do our utmost best to address as many questions as possible this evening. And after the question and answer, each of our speakers will have a final minute or so to share their closing reflections. However, before we begin our presentations, I'd like to extend our heartfelt gratitude to our program sponsors, Community Memorial Healthcare, including its hospitals, clinics, its employees, and the organized medical staff, and the Ventura County Office of Education. Thank you to both organizations so much. We deeply appreciate their continued partnership in promoting health and wellness throughout our entire Ventura community. And frankly, I personally applaud their courage in supporting a program like this at a time when emotions around this topic of vaccines tend to sometimes run a little high. And finally, and perhaps most importantly, I would like to thank all of you, those here in person and also those joining online. Thank you for taking the time to be part of this conversation and for your personal commitment to both learning and caring about the health of our families and our communities. So once again, welcome to this first of our public lectures on the facts and fictions about vaccinations. And now let's begin. Please join me in welcoming our first speaker, our County Public Health Officer, Dr. Yolene Castell. By way of introduction, Dr. Castell is the Director of Public Health and the Public Health Medical Officer for Ventura County. She earned her Bachelor of Arts degrees at Sarah Lawrence College in New York and went on to earn her medical degree from Temple University School of Medicine in Philadelphia, Pennsylvania. Dr. Castell completed her residency in a full-spectrum family medicine residency at the Ventura County Medical Center, which includes obstetrics. She has had over 15 years of public health leadership experience, including serving as Ventura County's tuberculosis controller, in addition to founding clinics for underserved populations and HIV prevention. In addition, she has served as Chief Medical Officer at Primary Medical Group and as faculty for the Family Medicine Residency Program at VCMC, where she mentored residents in preventative care, chronic disease management, and prenatal care. Her extensive experience in both clinical medicine and public health make her uniquely qualified to lead Ventura County's health initiatives. Ladies and gentlemen, please join me in welcoming our Public Health Medical Officer, Dr. Yolene Castell.
Hi, thank you. That was quite the introduction, Dr. Ornstein. Just a funny little story. Dr. Hornstein was an attending of mine during residency, 22, 23 years ago. So we've come full circle. So as Dr. Hornstein said, my name is Dr. Yolene Castell, and I am a family doc, and that is my passion and that is my training. I did train locally at Ventura County Medical Center more than 20 years ago and have been working in this community for more than 20 years as a primary care doctor. Currently, just as of this year, I started as the Ventura County Health Officer. So I was asked to join to talk about vaccines, as Dr. Hornstein mentioned, and I do have a perspective, but I also have a perspective as a mom of 2 kids that raised in Ventura County for 24 years, and I have seen thousands of patients over my 20 years as a primary care doctor and cared for them. And now I do have this perspective as a health officer and looking at the health of the community. So I have multiple hats and multiple perspectives. So let's get right into this. Next slide. Next slide, please. So I have been tasked to explain a few things, and I will try to do this as succinctly and quickly as I can. So what do vaccines actually do? And I think that there's some confusion about what they actually do. Many people believe that vaccines are designed to prevent a person from catching a disease. In fact, what vaccines do is to improve your immune system to better fight against a virus or a bacteria. Vaccines train your immune system to recognize, respond faster, stronger, and more effectively to that germ. In essence, they give your body a practice run to be ready if your body ever sees the germ. It means that in some cases, you will still get the infection after getting a vaccine, for example, flu or COVID vaccine. But your system can fight more efficiently, and hopefully you will not get so ill because your immune system has been prepared. The body, after a vaccine, now has the army of cells to fight against the infection. Some people say, very correctly, that they got the COVID vaccine, but that they still got the infection, sometimes multiple times. They think that that points to the ineffectiveness of the vaccine. But most of these people were not hospitalized, and they did not have severe effects of the illness that they may have had if their immune system hadn't been prepared from the help of the vaccine. Next slide. So how are vaccines made and tested? In developing a vaccine, scientists are held to exceedingly high standards, higher than most other medical devices. This is because we are giving these doses to healthy individuals, and most often to kids. The most common way that scientists have discovered a vaccine is by studying the germ itself that causes the disease. They will find a small, safe part of the germ, like a protein on the surface of the cell, that can train the immune system to recognize the germ and produce antibodies, which are our body's armies that protect against foreign invaders. An example of how long a vaccine takes from research to being given in your doctor's office is the HPV, or human papillomavirus, that protects people against the HPV virus, which is the main cause of most cervical, genital, and throat cancers. The research for that vaccine started in the 1980s, and it took 20 years of studying and more than 25,000 participants involved in the studies. It was finally approved in 2006. And even after approval, more than 100 additional studies continue to follow and monitor safety and effectiveness. It remains highly protective against the HPV-related cancers. Compare that to the amazing new meds, GLP-1, Ozempic, and Mounjaro. These are also shots. These meds took 5 to 7 years from research to approval. The individuals involved in the trials were approximately 1,500 to 5,000. That is not to say that this med is not safe, but it got to market much faster because it is a treatment, not a prevention, and it is mostly used on adults, not kids. Vaccines are not just followed by scientific studies after they come to market. You, the consumer, also can help monitor their effects, which people do. By signing up for V-Safe, which you can Google and find on your computer, it's a monitoring system that people, consumers, can report side effects of the vaccine or lack thereof. And that is ongoing and has been going on for many years. Next slide. How vaccines protect communities. Just a minute. So this slide was taken from a public health publication called Your Local Epidemiologist. And I think that this slide really helps to understand the big picture and the risk of letting natural immunity be our protection instead of getting the vaccine. Look at these two scenarios. I know it's kind of small print, I apologize. So nobody vaccinated and everybody vaccinated. Before the measles vaccine, nearly every child in the US by the age of 15 had measles because it's so contagious. So the risk of exposure was nearly 100%. So let's be conservative and call it 95%. And then at 100% vaccination, the risk of measles goes to 0. So if you look at this chart, scenario 1 is 0 vaccination with a measles exposure of 10,000 kids. So at 95% risk, 9,500 would get the measles. Complications from measles, of that population, 1,900 would be hospitalized, 950 kids with ear infections and potential hearing loss, 475 cases of pneumonia, 10 cases of brain infection, encephalitis, 3 cases of abnormal blood clotting, and potentially 10 to 29 deaths. So that is the scenario of 0 vaccination. Scenario 2 is 100% of the kids in contact with the measles case were vaccinated. So the exposure, 10,000 kids got vaccinated. Adverse events from the vaccinations. 3 can get fever-related seizures. These usually do not need hospitalizations. 0 to 1 cases of abnormal blood clotting, and 0 to 1 case of allergic reactions. Next slide. So what happens when coverage in the community drops? When vaccination rates fall, preventable diseases return. Fighting against infectious disease is a team sport, and it takes a community working together to create the protection that's needed for everyone. An example of this is measles again. To stop measles from spreading, it's necessary for at least 95% of the community to be vaccinated. A severe measles outbreak in 1989 to 91 due to low vaccination rates in preschool-age kids led to the creation of Vaccines for Children program. Routine childhood immunizations remain a highly cost-effective public health intervention, preventing thousands of childhood illnesses, hospitalizations, and deaths among kids. I keep bringing up measles because it's the most contagious of the germs we vaccinate against, and it's completely preventable. So it's an easy target. But this is true for many other infections that we vaccinate for. The Vaccines for Children, that program, now provides over half of U.S. childhood vaccines at no cost. Next slide. So vaccines work. The data from 1994 to 2003. So the creation of the Vaccines for Children program not only benefited many children across the United States, but it's also helped us weigh the impact and importance of vaccines. From 1994 to 2023, VFC, that program, prevented 508 million illnesses, 32 million hospitalizations, 1.1 million deaths, and 2.7 trillion in societal savings. 70 to 80 years ago, it was common for children in the U.S. not to make it past their first birthday. 1 in 20 children died before their first birthday. The main killers at that time were infections like whooping cough, pneumonia, measles, polio. Families didn't have all the vaccines and nutrition that we take for granted sometimes. Vaccines and modern medicine and better public health have helped improve this. Today, the main risks to that first year of life are birth defects, complications during pregnancy, and accidents. Today, the number are 1 in 200 children die before they turn 1. That is still way too many in my opinion, so we have work to do. Next slide. Access and equity. Access is key. Cost, location, and trust can all be barriers. Public health helps to bridge and remove these barriers by offering free and low-cost clinics, mobile vaccine events, and community partnerships. What equity means to us is everybody gets a fair chance at protection. Next slide. Since 1974, the global impact, vaccines have been the single greatest contributor to improved childhood survival worldwide. Global programs prevent millions of deaths each year, and continued investment is critical to sustain these gains. Remember that the success of vaccines is stealthy. No one notices when a disease or infection is prevented. But we see the numbers and the devastation before we had access to vaccines, and see now that kids are not dying of smallpox or paralyzed from polio. These are some numbers, global numbers. It's estimated that vaccines have saved 154 million lives worldwide since 1974, and 95% of those lives are kids younger than 5. This graph shows those statistics and shows the infections, therefore, that the vaccines have prevented. So I am done. I just want to leave, in closing, a quick statement. So vaccines are a victim of their success. We cannot see all the infections that were prevented or childhood deaths that didn't happen because of initiating universal vaccine requirements. They have made some very serious infections and diseases obsolete, and so we've lost a sense of urgency. But the germs are still there. It's just we've maimed and disabled them to a point that they pose very little risk to our communities when we have the protections in place. Imagine now if we discovered a vaccine that would prevent a lifetime of depression or cancer or obesity or screen time addiction. These are now some of these threats and dangers that we see our kids and wonder how they will survive and thrive when they all seem so prevalent. Maybe one day there will be preventative interventions for these dangers as well. I don't know. But the imminent threat and danger of infection is what parents and the medical community faced decades ago, and they stood up to meet that challenge to keep their families and communities safe. We want our children to have long and healthy lives that might even be better than ours. The world changes, and therefore risks change, and we expect our scientists and our doctors to be there to protect us from these dangers. Thank you.
Thank you so much, Dr. Castell. I'd actually like to just go off script for one quick second and reinforce one point you made. The germs are still there. I'd like to quote from yesterday, Monday, October 20th, from the Star, the Ventura Star. Got it here. And what I want to say is just two very quick paragraphs there. The first is, in 2000, so 25 years ago, many of us, it was just like that. But in 2000, the United States declared measles eliminated. What that meant was that there were no further spread within the country, and the few cases that were here typically came from abroad. That was 25 years ago. Measles was gone. It goes on to say measles has already had a record year this year, 2025 to date, and we're not done. It was the worst year so far in this century. Thus far, in 2025, according to the Star, the country has seen 1,600 new cases and already 3 deaths, representing the most cases in over 30 years and the first deaths in over a decade. That's exactly what Dr. Castell was saying. We were done with measles 25 years ago. It doesn't go away. The germs are still here, but we're a victim of our own success. We can do better. We have to do better. And speaking of doing better and doing well, it's now my great pleasure to introduce our second speaker, Dr. Allison Schumann. Dr. Allison Schumann is a dedicated pediatrician and is also the current Chief of Staff at Community Memorial Hospital in Ventura, a role she began January 1st, 2025. Dr. Schumann earned her bachelor's degree from the University of New Haven in 2003. Dr. Schumann completed her medical degree at Rutgers, New Jersey Medical School, where she also graduated as their valedictorian. She went on to complete a pediatric residency at New York Presbyterian Komansky Children's Hospital in New York City, followed by an additional 15-month pediatric critical care fellowship at the same institution. In 2007, she relocated to California and has been serving as a pediatric hospitalist in addition to being a general pediatrician in Ventura since 2008. Dr. Schumann is double board certified in general pediatrics and pediatric hospital medicine. She leads the Community Memorial Hospital's team of pediatric hospitalists, providing university quality care to children in our local community. Dr. Schumann is a very well-respected clinician, a wonderful medical staff leader, and personally a dear friend of mine. And it is my great pleasure to introduce my friend and the exceptional doctor and chief of staff, Dr. Allie Schumann.
Thank you so much, Dr. Hornstein. You may be younger than I actually am. I graduated with my bachelor's in 1998. So it's okay, you can make me younger than I am. So thank you, everybody, for joining us here in person tonight and online. It is absolutely my pleasure to speak to this really important topic. As Dr. Hornstein mentioned, I'm a pediatrician. I was a pediatric hospitalist till we moved everything over to county, and now I take care of newborns in the hospital, and I do general pediatrics through our Centers for Family Health here. We're in Camarillo, in Oxnard. I'm a mom to a 3-year-old, and I am really passionate about this topic, and that's why I'm here tonight. So without further ado, I'm going to go ahead and jump right in. I'll take my first slide, please. What can we do better? So let me just start with something that I've noticed and I think is that we as physicians and science communicators don't do a great job of acknowledging people's concerns. I think we walk in a lot and we say to people, listen, trust us, it's fine, we have studies, don't worry. And I think what we're doing in those cases is sort of missing the fact that a lot of people who come to us with vaccine hesitancy are not saying they think vaccination is bad, are not saying they don't recognize the risks of these infectious diseases, but they have concerns. Why do they have concerns? Well, when we talk about science, we talk a lot about how science is always in evolution, right? There are things we thought 30 years ago that is different today. We have new evidence. And I can understand why people come and they wonder, okay, well, you told us this was the case and that changed. Peanut allergy is a great example, right? We used to tell you you can't give peanuts till kids are 12 months, and then studies showed actually we should give it sooner, and guess what? We did that, and peanut allergy dropped by like 27% with that new recommendation. So, right, I get it. That's why parents wonder, well, isn't this going to change? Or how do you know that's not going to change? And I'm here to talk to you about how we have so much evidence that we really can confidently say, this is not going to change. We've had so many of these vaccines around for so long. So if we think about things like the polio vaccine, licensed in 1955, right? So that's over 70 years. The measles, mumps, and rubella vaccine, originally developed in the 1960s, combined in 1971, so more than 50 years. The diphtheria, tetanus, pertussis vaccine, again, coming in the 50s and 60s. We've had so much experience with these. And as Dr. Castell alluded to, we have monitoring systems that have been in place all these years. Our monitoring systems are so good at picking up tiny signals for harm that, I don't know if people remember, but when our COVID vaccines came out, there was one of the vaccines that was found to cause an increased risk of blood clots. We identified that within a couple months of that vaccine being given, and it got pulled from the market. Our vaccine monitoring systems are so good, they can pick up a tiny signal amongst the noise. We've had these vaccines for so long, so we know they're safe. I want to talk a little bit about some of the numbers, and I'm going to use the MMR vaccine because that often comes up with questions around autism, and just give you a sense of the number of studies that have been done related to some of these concerns and the number of children that have been looked at that tell us we can confidently say that these are safe. So this one study, first study, a population-based study of measles, mumps, and rubella vaccine and autism from 2002, over 500,000, so 500,000 Danish children they looked at, and they found no link in 500,000 children between the MMR vaccine and autism, regardless of their age, their sex, their birth weight, their family income, or the timing of their vaccination. Go to the next slide, please. Another study looking at 650,000 other children. Looking at that was in 2019, again, found no increased autism risk. A review of 138 studies, so we call this a meta-analysis where we look at a group of studies, so 138 studies that looked at more than 23 million children and found that both the MMR and the combined MMR and varicella vaccines were highly effective and had no link to autism or other serious conditions. There are small risks, which we all know, and we'll talk a little bit about that, like febrile seizures or rare clotting disorders, but they're far lower than actually those things that occur with natural infection with those viruses, right? So all these things we see, fever, seizures, something called ITP, that's the clotting disorder they're talking about, those things can all occur with natural infection, and the rates are actually higher with natural infection than there are with vaccine. And I'll talk a little bit about what are the rates of those complications with vaccination. Next slide. And then finally, study number 4, and there's way more than this. I'm just pulling a few things. We actually have hundreds of studies. So study number 4, another meta-analysis looking at 1.25 million children. Again, finding no evidence between the MMR vaccine and autism. So again, I want people to know, when we tell you this science is real, it is solid, it is safe, we have so much evidence. And we have this evidence over decades and decades, right? And so again, I understand why people come in saying, like, how do you know this isn't going to change down the line? And this is part of the reason, what Dr. Castell mentioned actually, that vaccines are the most well-studied medical intervention we have. Things we think nothing about, giving Tylenol, well, now people think about Tylenol, but giving Motrin, giving Motrin, taking Zyrtec, we think nothing about these things, right? Putting mosquito spray on us. Those things we think nothing of, and those are studied so much less than our vaccines have been studied. So I'm a mom, and I have to make a decision to vaccinate my child or not. So how do I come to my decision? And I will let you know, my daughter is 3, she is fully vaccinated. I actually got her second MMR early at 3 because I was concerned maybe next year when she turned 4, it wouldn't be available. And I wanted to make sure she was protected. So how did I come to a place where I felt comfortable, right? Well, something that we are not great at as humans is really kind of getting our minds around what risk looks like. So Emily Oster, she's actually an economist, but she has written books for parents, and she used to do a podcast for parents. And one of the things that she likes to talk about how we can get our mind around risk, was to think, if we did this thing every day, this action, took a vaccine, got on an airplane, ran across the street without looking both ways, if we know what the risk of that negative conclusion happening, so an airplane crash, dying in a car accident, not wearing your seatbelt, if we know what the risk is, and we did that thing every day, how many days or how many years would it take for that negative thing to occur? Okay? And I really like this. I was like, that's such a nice concrete way to understand risk, because when you tell me the risk of something is 1 in 1,000 and the other is, 1 in 20,000, that doesn't sound necessarily like a huge difference. Like, those are like still both not too small. Well, How do we understand that? As an example, so the risk of a fever seizure after the MMRV vaccine is about 1 in 86,750. So that means if you got the MMRV vaccine every single day, it would take you 250 odd years to have that fever seizure, okay? The risk of a severe vaccine reaction is about 1 in a million, anywhere between 1 in 20,000 to 1 in a million. So that would mean if you took a vaccine every day, somewhere between every 55 years and every 2,739 years, you would expect that reaction to occur, okay? So now let's look at what the risk of these diseases are, right? So the risk with measles, the risk of mortality, so dying, is about 1 to 3 per thousand. And actually, sadly, this year's outbreak is a perfect example of that. We've had about 1,600 cases of measles in the US, and we've had 3 deaths. So 1 to 3 per thousand, right? That means something would happen about every 3 years, right? Compare that to 1 in every 55 or 2,739 years, right? The risk of dying if a child contracts pneumococcal meningitis, which used to be one of the most common causes for meningitis, which is an infection of the fluid around the brain. The risk of death is about 1 in 10. That means once every week and a half, you would die, right? Versus, again, the risk of a serious vaccine reaction once every 55 to 2,739 years. So when we think about the risk of these diseases versus the risk of these vaccines, how did I decide to vaccinate my daughter? Well, it's certainly not because I walk in and say, there is absolutely zero risk to me giving her this vaccine. Nothing in the world could possibly happen. I acknowledge anyone who tells you that anything is 100% safe. Well, that's just not true. I drove from my house today. I'm afraid of flying. I have more risk of dying on the road to the airport, right? I do all these things. There's always a risk, but I knew that the likelihood of her having any sort of severe reaction with a vaccine was so small, and the risk if she contracted any one of those diseases was so big that that was a risk I was willing to take. I'm willing to risk once in 55 years in order to prevent once every week and a half. Absolutely, right? So I want to touch a little bit on some of the things families then come to me with outside of that risk for reactions that they're worried about, that maybe they hear, whether it's on social media or from friends or in the news, reading vaccine inserts. So common things they say is like, okay, but what about the stuff in the vaccines, right? These sound scary, these can't be good. So one of the most common ones I hear about is the concern for, well, there's aluminum in vaccines. I've heard that's a toxin, it's a toxic metal, that can't be good that you're giving that to my child. So a lot of these things that we're afraid of, I get it. Again, thinking about science communication, if anyone says, just don't worry about it, well, I understand why as a parent, if you hear that, that's concerning. That might be like, that sounds scary. Until you understand that aluminum is the most abundant metal in our earth. So my daughter's been exposed to that every day, crawling around on the floor. It's actually in breast milk. And if you give a child all their vaccines in the first year, they get exposed to about 4.4 milligrams of aluminum. And if you breastfeed them for a year, they get exposed to 7 milligrams of aluminum. So there's more aluminum in breast milk, and we don't have an option. We have to feed our kids something, our babies. So they're getting more aluminum from breast milk than vaccines. Well, I don't think that's something that people share with families to really understand why that's not something you need to be afraid of. In those quantities, our body is absolutely acclimated to seeing aluminum, and it's very good at excreting it. And you might hear, well, it's different. Eating it, drinking it, putting it in your muscle, that's different. But to your body, it's not. Because what happens? You inject it in the muscle, right? We don't inject vaccines into your bloodstream. They go under the skin or they go into muscle. And then it absorbs in your bloodstream. And if you consume aluminum, whether that's because your child's eating dirt because they're crawling on the ground, or they're having breast milk or formula. Formula, by the way, up to 117 milligrams of aluminum for the baby in their first year if they're formula fed. That doesn't mean formula's bad, right? It's just that we think nothing. We give babies formula and breast milk all the time. This is not something we think about as a problem. But your body gets it in the muscle, absorbs it in the bloodstream, or you take it in your mouth, into your stomach, and the same thing. Your body absorbs it into the bloodstream. And then it doesn't know where it got it from, whether it came from the muscle or the stomach, it got in the bloodstream, and it uses it exactly the same way. Another common thing I hear, thimerosal, mercury. Well, I want you to know there are plenty of studies that have been done that show that thimerosal, which is not the same thing as the mercury you find in tuna fish, right? So there's methylmercury, ethylmercury. Chemistry really matters, and how your body deals with those two different things is very different. However, it's actually not even of concern for our vaccinations in the US, because every pediatric vaccine, routine pediatric vaccine, that's single vial, which is all of them, except for some multi-dose flu vials, which most people don't even use anymore. Thimerosal was removed from all of those. Mercury was taken out of all of those in 1999 out of an abundance of caution before studies could be done to make sure that we weren't exposing kids to harm. Because we as pediatricians, doctors, family medicine doctors, we went into this because we want children to be healthy, right? That's our goal. Okay, so what about exposure? What about kids' immune systems? What are we doing? Are we overloading their immune systems? We vaccinate for so many things nowadays that I didn't get when I was a kid. Well, I just want you to look at this graph, and then I want to go through some numbers for you. So in 1983, I was born in 1976, so when I was getting my childhood vaccines in the 80s, we protected kids from 7 different diseases. And if you got all of your vaccines, by the time you were 1 at that time, you were exposed to 3,000 different antigens. And by the time you were 4, 12,000 different antigens. Through the beauty of science, we've been able to refine our vaccines. On the current, today, recommended CDC schedule, or AAP schedule now, if you give your kid all their vaccines, 2 things. 1, we now protect them from twice as many things. We have 14 diseases we can now prevent with vaccines. However, the exposure for their immune system is 10-fold less. So instead of being 3,000 antigens by 1 and 12,000 antigens by 4, depending on which vaccine your pediatrician uses, by 1, a child's exposed to between 150 and 204 antigens, and by 4, just 359 antigens. To give you guys a sense of antigens in the environment, a random cold virus has about 25. The average kid who's an infant or toddler up through school age is sick about 8, and all of you who are parents know, they're sick all year long, 8 to 20 times a year. So they get more antigen exposure from their routine colds than through all these vaccines. Babies' immune systems come out, and on day 1, they can actually manage millions of antigens coming in, and they do, because there are antigens in their little blanket they wrap them in the hospital, in the breast you put them on, in the pacifier you put in their mouth, in their own little hands, in everything they touch. And again, similar to the medications we give without kind of thinking about it, kids are getting exposed all the time, and we don't notice it because you can't see these antigens, but I do understand that when it comes to vaccination, you know you're giving them that, right? You're very aware of it. And Dr. Costello alluded to this as well. It's very difficult to see an invisible threat, right? I understand when a parent comes in my office, you know you watch your child get a poke in the leg or in the arm. You can see that. You can't see the thing they didn't get. I want to talk a little bit about some of the things like what have vaccines done? And I'm going to touch on some of the things and expand upon some of the things Dr. Costello touched upon. So, how many lives have been saved? Well, in the early 1900s, before the age of 5, 1 in 5 children didn't make it to their 5th birthday. 1 in 5 kids. Today, when families lose their children to cancer or a car accident or gun violence, that is unthinkable to us, the idea of losing a child. In the 1900s, 1 in every 5 children died before they turned 5. People lost children all the time. That is not something that we have to even think about nowadays. Vaccines are predicted to save 1 pediatric life every 6 minutes. Between 4 and 5 million lives every year. 1 pediatric life saved every 6 minutes is 8,690 pediatric lives saved every day across the world. Let me put that into perspective for you. In the 2020-2021 school year, The Ventura Unified School District said there were about 1,100 first graders in the school district. So let's assume there's about the same in every grade, about 1,100 kids in every grade. That means every day, vaccines save every life of every children from first grade through 8th grade. Imagine every day, every one of those children dying. That's how many lives are saved every day. Pediatric lives saved every day by vaccines. That is profound. I don't think we can get our mind around it, but to think about that, if there was something that came to this community, right? If that was in just your community. Now I understand this is worldwide, so no community is gonna see that impact. But let's just pretend for a minute. Oh, all of those that would have died without vaccines, we're gonna have it happen here. That means every kid in Ventura Unified School District between 1st and 8th grade would die in one day. That's unimaginable. When we think today, one of the big pushes I know is treating the root cause of disease. I can't think of something that is more the epitome of treating the root cause of disease than actually preventing a disease from occurring. To me, vaccination is the cornerstone of treating the root cause of disease. And I understand parents' concerns and their questions. I want all parents to know, we as pediatricians, family doctors, we genuinely want for your children what you want, right? We all want the same thing for our children. We want to take care of them. We want them to be healthy. We want them to grow. We want to watch them thrive. One of the ways we can make sure that happens, one of the ways we can prevent loss that doesn't have to happen, is through vaccination. Thank you guys so much.
Thank you so much, Dr. Schumann. Our next speaker is Dr. Melissa Foster. Dr. Foster is the coordinator of hearing services and school nurses at the Ventura County Office of Education. She earned her Bachelor of Science in Nursing from California State University, Fullerton. Dr. Foster went on to earn her Doctor of Nursing Practice degree, furthering her expertise in nursing leadership and in nursing education. In her current role at the Ventura County Office of Education, Dr. Foster oversees the hearing services and school nursing programs, providing essential support and resources to all the school nurses throughout our entire county. Her work ensures that students receive comprehensive health services, promoting their well-being and, frankly, their academic success. Dr. Foster is a dedicated healthcare professional committed to enhancing student health services throughout Ventura County. It is my extreme pleasure to introduce our last speaker, Dr. Melissa Foster.
Thanks, Dr. Hornstein, and thanks to Community Memorial for letting me be a part of this today. As a school nurse, I've seen firsthand how vaccines protect the health of our students and in turn keep our community safe. This work is really about all of us working together to keep our community healthy and thriving. Schools are trusted spaces where our kids learn and are healthy all together. That's something that just happens in that space. Families turn to their schools for reliable information and support. Frequently, we become that first connection when their child's well-being is suffering. When schools, families, and public health work hand in hand, we build a stronger, more resilient community. And in Ventura County, we see every day that healthy students learn better. They miss less school. They bring a sense of well-being home to their families. And by supporting students' health, we're supporting the learning. These two things go hand in hand. Next slide, please. When children are protected through vaccines, they're less likely to miss school. And that consistency benefits everybody. It benefits their teacher, it benefits their parents, it benefits their classmates, and our community. A recent study found that vaccinated children miss fewer days of school than those who aren't vaccinated. Vaccinated children miss about 2.5 days, where the unvaccinated child might miss 4 in 100 school days. Most of our kids go to school about 180 days, so that's about 5 days missed for a vaccinated student and 8 days for an unvaccinated student. This difference matters. It may not look like it matters for 1 year, but if you look at that over the course of their whole school career, that's a big loss for that child. When students are healthy, families experience more consistency, there's less disruption to our schedules, fewer missed work days, and there's less stress at home. Vaccines are simple, they're effective, and they're a way to keep our learning on track and our classrooms open. We know that as school nurses, families have lots of questions when it comes to vaccines, and we welcome those questions. Our schools should be a safe place where we can have open and honest conversations. And when we listen with empathy and respect, families should feel heard, and that helps to build the trust with them. Research shows that when people feel respected and supported, they're more likely to consider the evidence-based information and make informed choices for their child's well-being. I can imagine this makes Dr. Schumann's job a lot easier when she sees the kids in her clinic. Our approach as school nurses is clear. It's caring and it's grounded in the facts. It's not judgmental, there's no pressure. We're working alongside families as trusted partners. We want them to be informed, we want them to be supported, and we want to include them in helping to keep our school community healthy. Next slide, please. And keeping our schools healthy is a team effort. Families, educators, school nurses, and our public health partners have to work together. When students stay up to date on their immunizations, they're protected themselves, and they also protect their classmates. They protect their whole school community that way. And this is how we care for each other as a community. When we offer quick communication to our families, when we have a strong partnership with public health, it helps us to respond early and share accurate information. And it can prevent those small issues from becoming the larger outbreaks. The National Association of Nurses and the American Academy of Pediatrics remind us that strong public health partnerships are key to maintaining healthy learning environments. Together, we keep the classrooms open, we keep students learning, and the whole community thrives. It's all about connection, prevention, and how we care for one another. Next slide. So as a school nurse, I've seen an outbreak or two, some bigger than others. And I just want to share with you my experience with regards to that. When I was working as a school nurse, one of the schools that I was assigned to had a couple cases of chickenpox. At first, we thought this probably wasn't such a big deal, but they were happening pretty close together. So I reached out to my local public health nurse that serviced our area, and we had a conversation about this. And we realized that this was a place that we needed to work together, and we needed to work together quickly. As I started to comb through the vaccine records of my students, we realized that we had over 100 students who either had an exemption or were under-immunized. And so those students had to stay home for somewhere between 14 and 21 days while the chickenpox took its course through our school. It was challenging for our school community. It was challenging for the staffs, and it was challenging for the students. They missed learning. Families had to adjust their schedules. We had to cancel open house. Some of the staff and parents had to miss work. The chickenpox situation seems like an extreme example for what seems to be a simple disease that we all think is eradicated. But an outbreak like this can disrupt the learning of our students, and even smaller interruptions like an exposure to whooping cough can cause missed school days and cause great worry to our families. What stood out most with the chickenpox outbreak was the partnership that was developed amongst my school community, the families that we serviced, and our public health team. We had a lot of open communication. We spoke to public health probably every 3 days on a conference call, and then we passed that information on to our families so that they had firsthand knowledge about what was happening. We did our best to get the students back into the classroom as quickly as possible. This experience reminds me that vaccinations and strong communication are key to keeping classrooms open and our community thriving. After everything that we learned from the pandemic, we know how difficult distance learning can be, not only for our academics, but for families, for connection, and for our own mental well-being. When we do our part, students keep learning, families stay supported, and schools remain healthy and welcoming places for everyone. Next slide. As I wrap up, one simple truth stands out. Vaccines keep children in school, parents at work, and our community healthy. Healthy schools mean consistent learning, stronger and more connected communities. Every conversation, all of our partnerships help us reach this shared goal. Keeping kids healthy keeps our classrooms open and our community thrives. I hope that you've seen the impact our collective effort can make. And thank you for being a part of it. Together we can make the difference for our students, for their families, and for the health of our community.
Thank you so much, Dr. Foster, and thank you so much to our speakers for these initial thoughtfelt and heartfelt presentations. Now I'd like to take some time for some question and answers, but actually, if you don't mind, would everybody like to stand up for 1 second and just, we've got some nice food over to your right. We've got some drinks over to the left. If anybody would like to pause for a minute, please go ahead and take advantage of that. Please feel free to get the goodies that are here and something to drink, and let's go ahead and start. Okay? The first question, a large number of people have this question, and it actually concerns side effects. Let me paraphrase. Many people have heard that vaccines cause autism. That's been mentioned. It also causes, according to some, DNA changes, infertility, and they even contain toxins or microchips. How do I know that the data about side effects isn't being covered up? I feel frightened, and it's important that we address this head on. So what I'd like to ask our panelists, help us understand what's actually in vaccines, what you've already talked about, how post-vaccine monitoring works, and why some of these claims persist even when they've been thoroughly studied and disproven. Anybody want to take a shot?
I mean, that's a tall order. I'll answer part of it, and I don't know if the other panelists want to chime in. I'm going to actually let you answer the autism because you had a great answer earlier. There are some additives and preservatives in vaccines. Thimerosal is one that people talked about, that was talked about earlier as well, and that is a mercury-based preservative that is only used in multi-dose vials. And again, we don't use multi-dose vials very much, but in 1998, when the initial study, and I say that with some hesitancy. Again, we'll get back to that in a minute. When the study came out focusing on vaccines and autism, and that was disproven after that study came out, people turned also to the additives in vaccines, and that the thimerosal was also studied and shown through multiple studies that there was no cause and effect with the preservative and autism, but it was taken out because of the noise around that, and so we don't have that in any of the vaccines that are single dose. It was never in the MMR vaccine. It was never in the polio vaccine, and a few others. Another preservative that is found is formaldehyde, which is a big, scary word. And formaldehyde is actually a natural occurring substance that we have naturally in our body. And in incredibly small doses, less than what is naturally available in our body, it has been used in some vaccines, again, as a preservative. It is a safe and has been studied over thousands and thousands of studies to show that at the dose that was used in the vaccine, that it does not cause any effect. I I think, do you have it?
I was just going to say there's actually more, so to the formaldehyde, yes. So we have more in our bodies naturally. There's actually also more formaldehyde in a pear than there is in a vaccine. So again, and when we think about preservatives, I think we think about food and preservatives. When we think about preservatives and vaccines, we're talking about something that's preventing bacterial growth, right? You don't want your vaccine to have bacteria growing inside of it that we then inject into you, that you then get infected with something, right? That's a contamination. So it's a preservative in terms of preventing bacterial growth. It's not like when you think of a food preservative, because a lot of these words I think are very charged. They're used sort of across the board without really understanding like what exactly we're talking about. And I would say that in science communication in these places, semantics really matter. So we really understand what we're saying when we say preservative. It means preventing contamination, preventing bacterial growth.
Do you want to talk about the study in 1998?
Sure. Okay. So actually, this is interesting on multiple levels. And so, where did the idea of MMR autism come from? So in 1998, there was a British then physician. His medical license has since been revoked, and it was actually because of this. But a British physician named Andrew Wakefield, who did a study on 12 children, a number of whom were kids that he actually recruited from his own son's birthday party. And through that, he came out saying, I think there may be a link between the MMR and autism. An investigative reporter actually ended up going and looking and found that a few things. One, there was falsified information and data in his study. He was getting paid about $500,000 by a legal company that was suing the MMR manufacturer, and he was actually trying to develop his own MMR vaccine, so a lot of conflicts. That study was published in the Lancet Journal in that year, in 1998, and as they went through and started to look at this, the other authors actually took their names off the study, and the Lancet Journal actually retracted the study. And in medicine or in science, that's almost unheard of. So when we have new science, we don't retract old studies, we publish the new study, right? We publish the new information. We don't retract old information, we build upon it. So when we retract a study, it's because it was deeply flawed. And that's what they found with that study, and it was not reproducible. So this is when we think again about how do families know? How do you know this is not going to change? When we look at science, what we want is results that are repeatable and consistent. Well, this one study of 12 children where he raised a concern and was found to have falsified information and got retracted. Since then, you go through just those 4 studies that I put up, and that's just 4 of hundreds, have looked at, again, millions upon millions upon millions of children. And what is repeatable and consistent is that no link between MMR and autism has been found since that time. The interesting thing, I think, sometimes with this is how information leaks. So when families come in concerned about vaccines and autism, well, the only thing that was ever potentially linked was MMR. But somehow all the other vaccines got swept up in that. Now, we've disproven the link between MMR and autism, but none of the other vaccines were ever even remotely implicated. I see that a little bit now with Tylenol, where, we don't need to get into all the studies, but it's leaked out to be from the initial thing that people were talking about, like maybe Tylenol in pregnancy, to be don't give your child Tylenol for a circumcision. Well, there's not a single study that's looked at that, right, that leak. And it's so easy to pick up this information. And once it's picked up, there's lots of evidence to show that it's much easier to spread bad information. It takes about, let's call it 20 calories of energy to spread something. It takes, about 100 times that to retract that and get the bad information back and get people now to believe the good information. And that's kind of the difficult thing about the time we're in, because information spreads so easily. And I don't think people who are hearing this are purposefully, I don't think they're not smart. I don't think, it's hard and scary when you hear something. And once it's in your ear, it can be hard to get rid of. It's very hard for us to combat that. But so just to speak to a little beyond the MMR autism thing, but just how that stuff can leak out. When you have questions like this, again, talking to your physician, and hopefully your physician is informed enough, and if they're not, hopefully they'll be willing to get the information for you to really answer those deep questions, not just saying, don't worry about it, trust me, to really give you those answers so you can feel safe.
I'll just chime in a little bit about the COVID vaccine. And there was a concern with the COVID vaccine and something called pericarditis in young boys. And that is an infection of the wrapping of the heart. There was an uptick in males between the ages of 12 and 17 after the second dose of the vaccine. But it is still less common than pericarditis caused by the actual COVID infection. About 12 to 17 cases per 1 million doses in males that got the vaccine. So I can't do the math fast enough, Dr. Schumann does, but I don't know how many years that would be of getting it every day, but 12 to 17 cases per 1 million. And most cases are mild and treated outpatient with medications. The incidence in pericarditis in people with infection with COVID is 200 per 100,000. So again, as Dr. Schumann says, we can't say that there are no side effects and no risks with vaccines, but the risks are so much smaller than the actual infection that we all feel in the medical community and also as parents that risk is worth it.
I think it would come out to about once every 162 years if I'm doing the math correctly. That's assuming 17, the higher end, if I'm doing the math correctly.
Thank you. Another question that has come up, actually broader topic, is about natural immunity. And some of the questioners have asked, if I have a strong immune system, why do I need a vaccine at all? Isn't it better to get the natural infection and build my immunity that way? And I think that's actually an important question. So to our panel, could you help us understand how vaccines mimic the natural process, but without the risk of serious illness or complications?
I like to think about vaccines kind of as like creating a force field for you, if I had to describe it to my 3-year-old, right? So you get this small protein from a virus or bacteria, a piece that your immune system will recognize, but that can't actually cause illness. Or in our live attenuated vaccines, a virus that's been weakened so much it can't actually grow and reproduce and cause infection. Your immune system sees that, it responds to create antibodies, right? That's that force field. Your antibodies are like your force field. So that when you come in contact with the actual virus or bacteria, it can't multiply. There's not a chance for it to multiply and cause actual disease. Why is that a better idea than natural immunity? So a couple things. The biggest one would be because the risk of complications from these illnesses with natural immunity is so much higher than the risk of complications from immunity from vaccination. I think, to me, that's the biggest reason. Again, like going back to what I was talking about, I'd rather take a 1 in 20,000 or 1 in a million chance than a 1 in 1,000 chance of like the worst possible outcome. And when we think about severe vaccine reactions, we're not talking dying from a vaccine reaction. We're talking about like a severe allergic reaction. When we think about the worst case scenario with actual infection, we're talking about you dying, like you're actually dying of that infection. That's the worst outcome, 1 to 3 in 1,000 for measles. So why would I prefer vaccine immunity to natural? That's part of the reason. Certain viruses, if you get natural immunity, so again, I'll use measles as an example, sure, you have immunity to measles. But once you have measles, even if you start, so you're one of the 997 people out of 1,000 who survived. That's amazing. You may think, wonderful, I survived, my struggle is over. However, once measles is in your body, the actual virus, there is a portion of people that about 10 to 12 years later, that virus then infects your brain cells. There's no way to prevent this once you have developed measles and infection. That's basically uniformly fatal. There was actually a child in Los Angeles recently who died of this. It's called subacute sclerosing panencephalitis, or SSPE. And the virus itself kind of reactivates, infects the brain. For lack of a better term, just basically eats the brain, dissolves it, and is uniformly fatal, untreatable. And once you've had measles, That's on the table for you forever. COVID is a good example for children. While children didn't, in the original pandemic, necessarily get severely ill with COVID, they did have this risk for post-infection, something called MIS-C, which was a severe systemic inflammatory response that led to cardiac, to heart failure, liver failure, multi-system shock, high rates of death, and ICU illness. So they may have survived the COVID and gotten natural immunity, but then they had, once they'd had COVID, they were at risk for this severe complication from the virus about 4 to 6 weeks later. One of the things that they showed with vaccination for COVID for children was that it actually protected them, even if they caught COVID, from developing MIS-C. So my daughter vaccinated for COVID. First year, she got her 3 doses. She got her booster last year. If I can find it this year, I'll get it for her this year. And really, for me, the main reason was to prevent MIS-C, because I saw how sick those kids were, right? Knowing kids do pretty fine with COVID. But still, that was not worth it to me. So those are just, for me, a few reasons why vaccine immunity is a better choice than natural immunity.
Well, the other thing would be the herd immunity, which you talked about with the chickenpox, and kids were out of school for 14 to 21 days. So natural immunity means that you're putting other people potentially at risk. You may glide through the infection, but elderly people who are vulnerable, pregnant women, and kids are too young to get their vaccines yet, they would be at risk too. So again, I'm always speaking from the public health, well, not always, but speaking from the public health perspective, that in allowing natural immunity, you do put other people in the community at risk.
I also want to spend just a second, as you both mentioned, chickenpox. So I'm married and have 3 children, and 2 of my 3 got natural chickenpox, as my wife and I did back in the day. And in fact, not only did we do that, but we had something called chickenpox parties. Anybody remember those? Yes, and believe it or not, there were such things as chickenpox parties. And what that meant was, back in the 50s, 60s, one person got chickenpox in your community, and you invited everybody to come over because it's such an infectious disease. They would get it, you'd get the rash, you'd get over it, and that's that. So I remember 2 of my 3 kids got chickenpox. My 3rd, the chickenpox vaccine came out, and I was thinking to myself, just from my own experience, I was already a doctor, I already had 2 kids, they got chickenpox. Should I give my 3rd child, who now the vaccine was out, should I give it to her? And I was thinking, who developed this vaccine? Of all the vaccines, why chickenpox? That seemed like the most innocuous. Yeah, you had 2 weeks, it was a bad virus, but you got over it, we all did. Until, of course, somebody came to my office, and I'm taking care of a patient now. She's actually in her 50s, very sweet woman. I can't tell you more about her. But she is disabled completely. She has never held a job. She has never gone on a date. She can never work, and she is severely disabled. And I had been taking care of her for several years. And finally, I just said, "Oh, so you had this from birth?" And she goes, "Oh, no. I was a healthy 9-year-old girl like anybody else, any other child, and I was taken to a chickenpox party. And at that party, I got chickenpox, but unlike everybody else, I got chickenpox encephalitis, which was an infection of her brain. And from that time on, this normal, healthy girl has now been disabled, and sadly, she just lost both parents who have been caring for her, and now she's going to have to figure out how to make a life for her own for the rest of her life because of a disease that I wasn't even sure was worth immunizing for." So I learned a lesson, not from my own experience, but from my experience as a physician, actually taking care of somebody who had what I thought was a trivial disease. What's the big deal until you see it? The fact of the matter is, these are real. These happen to people. This is our community. This is Ventura. This isn't theoretical. This isn't from a textbook. This is real, and this will impact her for the rest of her life. Every child that I take care of gets chickenpox vaccine, because one of those cases is one too many from where I sit. and that needs to change. Again, I learned that being as skeptical as any other vaccine skeptic. But I want to move on very quickly just for another, and I actually have a question to ask Dr. Foster. And this brings us to questions that came up. Frankly, the broader topic I'm extrapolating is freedom and choice. And what people are asking is, why should anyone tell me what to put in my body? What about medical freedom and independence? Why are vaccines sometimes mandated for children and for certain other jobs? Now, these are deeply felt concerns for some parents. And to Dr. Foster and our panel, could you talk about schools and public health agencies who try to balance personal freedom with the responsibility to take care of all students and families and make them safe for our communities, especially those who may not be able to get vaccines and be medically vulnerable? Dr. Foster?
Yeah, so I think mandating the vaccine for the children, the children themselves don't have the ability to make the choice. Yes, I want to get vaccinated. No, I don't want to get vaccinated. So those guidelines by the American Academy of Pediatrics and our state are put in place to help parents make good choices to keep their children safe, just as we make good choices when we buckle them in their car seat to take them to school every day. And then I think that leads into helping them grow to be healthy, successful adults so that they can attend school on a regular basis. And I think about Dr. Hornstein's story just now with regards to the chickenpox. That was not something that we saw with our chickenpox outbreak, but it was a possibility, and we had lots of teachers that we were concerned about, elderly people in our community that we were concerned about, that the students would interact with. So it goes beyond just the mandate for the children, but it goes into taking care of our community as well and keeping them healthy.
One of the comparisons I like, or metaphors I like, is, if you're vaccinated, why do you care if I'm vaccinated, right? So one of the metaphors I like, or comparisons, is it's like having a drunk driver on the road. Just because I have my seatbelt on, like if there's a drunk driver on the road, I'm still in danger. Sure, I've got my seatbelt on. I'm a lot safer in a crash, but I'd like to avoid getting in a crash, number one, right? So I don't want you driving drunk on the road. I want there to be a law that says you can't drive without a license, you can't drive drunk, so that I'm protected, less likely to be in an accident, because if I get in an accident, yeah, again, my seatbelt helps keep me safe, but does that mean I'm 100% protected from the chance of dying in an accident or being permanently injured? No, of course not. Vaccination is very effective. Again, nothing is 100%, right? Our most effective vaccines are about 97 and 99% effective in protecting. Some of them are, on any given year, the flu shot may only protect you 60 or 70% of the time. Again, I think of it like a seatbelt. If I get it, I'm going to be less severely ill. I'm less likely to get it overall. I don't skip it just because it's not 100%, just like I don't skip my seatbelt. But that's why this herd immunity, this community stuff is so important, right? Because our choices do impact people far beyond ourselves. They just had a child in Louisiana who died of whooping cough, who was too young to be vaccinated. I had a 4-month-old in my office who had whooping cough. She had 2 of her shots, but not all of them. She wasn't fully protected. Somebody else infected her, right? So the choices we make don't just impact us, and we all owe it to each other to take care of each other.
I think we have time for maybe 1 or 2 more questions. This one came up and was asked several times. I think it's a big one. And and basically people are asking, why should I trust the government or drug companies when it comes to vaccines? Aren't they making money off of this? Didn't some vaccines get rushed into production, like the mRNA vaccine? How do I know the science isn't biased? And I guess this is really asking about skepticism as being part of an informed citizenry. Can you answer that?
So I just want to touch on one thing, which is that, so one of the things you hear often is like big pharma. So obviously pharmaceutical companies are companies, they want to make money. I always want to point out that vaccine profits are about 1% of total income for pharmaceutical companies. The vaccine, pharmaceutical industry, all of that is about, billions of dollars. The supplement industry is trillions of dollars of income, right? So if we're going to be skeptical, we need to have the same skepticism across the board of everyone. But vaccines represent only about 1% of pharmaceutical income. For pharmaceutical companies, their income would be better served by you being sick, because guess what they're going to be then giving? The medications you're going to get in the hospital, right? Hospitals would be better suited if you were sick. Why? Because they get paid for you to be in the hospital, right? When doctors, we get paid to take care of you when you come in or when you're in the hospital. So when we're trying to get you not to be sick, right, it's not coming from a drive for profit. Common misconception, I saw something out there that said pediatricians make 50% of their income off of vaccines. So most pediatric offices lose money on vaccination. They actually pay more money to stock the vaccines than they get reimbursed for giving the vaccine. So that is a money-losing venture for for almost all pediatric offices. And by law, no doctor can actually take money from a pharmaceutical company. So we do not get paid for giving vaccine from pharmaceutical companies. We can't even technically we're not even allowed to take pens or let them buy us lunch. That is what the law is. And it's really specifically, I think, to be able to create that credibility, right? So that the public can know that we are not on someone's payroll. We are not doing this to benefit ourselves. We are not doing something shady, that we are doing this really truly for the well-being of the people that we care for. So that's mine.
You answered that wonderfully. The mRNA vaccine that you mentioned that, right? So the mRNA vaccine, which was the two major COVID vaccines that came out, and people kind of wondered, how did those come to market so quickly, and what, is that weird science and inappropriate science that brought it so quickly? The mRNA technology came about in the 1960s, and scientists have been looking at it, researching it, reviewing it. It actually did come out in a vaccine that luckily we don't really need here, called the Zika virus. And that was used in countries that are infected with that. And so that was used earlier on. But it was in research, again, since the 1960s, and kind of sitting there waiting. And then when COVID hit, and we all had to pivot, and all this research and all these scientists pivoted from doing research on their own to everybody was focused on COVID. And then they discovered that this molecule and this technology actually could be used for the COVID vaccine. So I think that people had this idea that it came out of, February of 2020, and then by March of 2020 or whatever the timeline was that we had the vaccine, but it actually had been around again since the 1960s. And it is likely going to be used in many other types of vaccines. There's research out there right now that shows that mRNA technology may be able to vaccinate against certain very common types of cancer. So we may be seeing that sometime in the future as well.
I think we have time for one more quick question. Is vaccine hesitancy and vaccine resistance that we're all experiencing now a new thing? Is this something we've never seen it before, or is this cyclical? Have we seen it in the past?
So vaccine hesitancy has been around since the very first vaccine, the smallpox vaccine. There are posters, if you go back and look during that time, where they don't give your child the smallpox vaccine. This is going to sound ridiculous, but they were concerned it might cause your child to turn into a cow. I know that sounds ridiculous, right? But this a different time, different beliefs. But so that's been around forever. Vaccine hesitancy, worries about vaccines have always been there. Which vaccines people are worried about or why have changed, but that concern, that feeling has always been there. Smallpox vaccine, of course, eradicated smallpox, right? Not something we have to worry about anymore. I don't have a scar on my arm. My mom does. You know, my mom tells stories about when she was a kid and during the summers, right, you wouldn't go to the pool because there was for polio, right? Not something parents think. Now we look forward to the summer. I'm getting my kids swimming lessons. We're going to the community pool. So it's always been there, but vaccines have proven themselves. And just so everyone knows, George Washington had one of the first vaccine mandates because he forced all of his troops to get the smallpox vaccine. So mandates and hesitancy have been around forever.
I think with regards to vaccine hesitancy, I think what's changed is the speed at which we get information and how that's passed on from person to person, and not always accurate. Like you said that the study was about the MMR vaccine, and now all of a sudden all the vaccines are wrapped up into autism. So it's more about the speed at which we get the information that I think makes parents hesitant with regards to getting vaccines for their kids.
You know, I just wanted to very briefly share an experience I had when I finished medical school at UCLA. My last rotation in medical school was in Scotland at the Infectious Disease Hospital. It was a very good one in Scotland, Edinburgh, Scotland. And I went there from UCLA and Cedars-Sinai where I trained, and I walked in through the back door my first day. I was wearing my white coat. I was very proud. I wanted to represent the United States and wanted to make a good impression. And I'm sitting there 20 minutes beforehand and waiting, and as I was in the hallway, I heard, and I'd never heard that before in 4 years at UCLA or Cedars-Sinai or Children's Hospital LA where I trained. And anyways, all the doctors from Scotland came, they introduced me, and I was very proud to represent UCLA in the United States. And they said, "Do you have anything to say?" And I said, "Yes, I'm not sure this is true, but I think I heard whooping cough." And they went, "What? You heard whooping cough?" And I said, "I've never heard it before in all my time at UCLA and in Los Angeles, but I think I did." And they said, "That's amazing." And my attending, the head of the department, said, "I have one question for you, Dr. Ornstein." I said, "What is that?" And they said, "What door did you come into the hospital?" And I thought he was nuts. "What door? What does that matter? I heard whooping cough." And he goes, "What door?" And I said, "Well, I came in through the employee entrance in the back." He goes, "Good. Ladies and gentlemen, let's take Dr. Hornstein and all the wisdom of Los Angeles to the front of our institution." And I walked to the front thinking they were nuts, and what am I doing in Scotland? And in the front, it had a very beautiful sign saying the Royal Infirmary of Scotland, of Edinburgh. And right next to it, in a sign the size of a enormous poster, it said, "Whooping Cough Ward," okay? Letting everybody in the world know that there were 200 patients in the hospital with whooping cough. Had I walked in there, yes, there was whooping cough there. In fact, there were 200 people there. And of course, I felt foolish. But then the second question is, why? Why did they have whooping cough wards in Scotland where there were 0 in Los Angeles? And the reason was because vaccine hesitancy came to Scotland because nobody in Scotland had seen pertussis, whooping cough, for so many years. Just as Dr. Cassell said, our own problem is our success. They didn't see it, they didn't believe it, they stopped doing it, and a few years later, here's whooping cough, ward after ward, children after children, which I never saw in Los Angeles, and I saw ward after ward. So the fact of the matter is that was in the 80s. For a different illness, different time, we're seeing measles now, we're seeing flu now, we're seeing other infections. But this is not, you don't see something, you think, well, it's not there anymore, it's gone, it's cured. But it isn't. These viruses, these bacteria are not our friends. They never will be, and we need to be vigilant. Okay. Well, again, at this point, thank you so much to everyone who gave us your thoughtful questions, and thank you for all our answers. I think we've covered a lot of ground, but I'd like to give each of our speakers an opportunity to give a brief closing summary of about a minute or two, their soapbox to give us their key message about what they'd like to remember as we leave here today. Dr. Cassell.
We do not have any measles cases in Ventura County. I just want to be clear about that. Yes. I want to say that Ventura County has done a good job of herd immunity. Our numbers from the school, from entering kindergartners. We have good, slightly better than the state of California herd immunity. So thank you, Ventura County, for that, and I hope we continue with that. I think, again, what Dr. Hornstein says is vaccines are a victim of their success, and that's wonderful. It is wonderful that we are here, and again, we can debate and talk about it, and I welcome the questions, but we have to remember that we're here because they have been so successful, and we don't see the risk anymore. And maybe in 20 years we'll be talking about, no more obesity, no more depression, no more anxiety, and people will wonder, why were we so worried about this years prior? So prevention is not an exciting mode of medicine, because you don't see anything with prevention. You never get sick, but it's so important to all of us, and especially to our kids.
Thank you. Dr. Schumann.
So one of the things that I always tell families when I'm talking to them about so many things that we do is that it's not my job to make a decision for parents. It's my job to make sure that they have all the information that I think is important for them to make a fully informed decision. So they understand that whatever choice they're making, they really understand the full depth of the risk and benefit and reward. And then they get to decide for their family what the right answer is. I hope through our talk tonight that we've made you all feel fully informed in a way that hopefully makes you feel like truly you can feel safe, that you will be helping and not harming your child if you vaccinate them. Because what I really worry as a pediatrician is that the thing that's going to swing the pendulum the other way is going to be children losing lives unnecessarily. I really do worry about that. The 2 pediatric deaths from measles, so there was an adult death from measles about 10, 15 years ago, but the last pediatric death before this year was over 20 years ago. And so I hope that that's not what has to happen for us to realize the benefit and the importance of vaccination for our public health, for our children, to protect ourselves, to protect them. And just thank you, everybody, for your time, your attention, your open minds, and give me a holler at my office if you have questions.
Dr. Foster.
Yeah, and as a school nurse, I just want to say that, like I said earlier, the healthy learning environment of the school is where students feel connected. They come to school ready to learn and to engage and be a part of their community. And I think vaccines are the key to keep them in that space. I appreciate the partnership with public health and our pediatric colleagues. And I think that just reminds us that this is truly an important piece of keeping our kids safe and healthy so that they're ready to learn. And I also think that we need to remember that also keeps our community healthy. It doesn't stop at the doors of our school. It goes outside the doors of our school and keeps our whole community healthy.
So before we conclude, I'd like to take a moment to offer my sincere thanks, first and foremost, to our 3 outstanding speakers. Thank you for your time, your expertise, and your genuine commitment to educating and caring for our community. You've helped us better tonight understand not only the science behind vaccines, but also the trust, values, compassion that go along with them. Ladies and gentlemen, our 3 wonderful speakers. Those were flowers. I also want to extend our deep appreciation to our hosts and sponsors for this evening, the Ventura County Office of Education. First, Dr. Cesar Morales, Superintendent of Schools, and second, Dave Schumer, Director of Communications. Thank you so much. Next, to my home institution, Community Memorial Healthcare, for their wonderful partnership and support. A special thanks to those who made it incredibly possible to begin these important public conversations between all of us, between our health system, education, many partners, and the community. I'd like to have a special thanks to Mr. Mick Zeblick, President and CEO of Community Memorial Healthcare, Jamie Mates in the back, Vice President of Marketing and Development at Community Hospital, Evelyn Scott to my left, Director of Wellness at Community Hospital, Megan O'Neill, who I don't see her, wait, outside. Thank you so much, Megan. And Dr. Rob Streeter, Chief Medical Officer for Community Hospital. Thank you all so much for your leadership and encouragement in creating forums like this, ones that help build trust and relationship throughout our community. Thank you so much. And finally, and perhaps most importantly, thank you to all of you, both here and remotely. Thank you for taking the time out of your busy lives to learn more about issues that affect all of us, how we live, how we stay healthy and become more healthy, and how we also learn to support each other. Let's keep this conversation going. Please share your feedback with us. Tell us what's been helpful, what you'd like to hear more about, and how we can continue to meet your needs. And so in summary, to all of you, have a wonderful evening, be well, thank you, and good night.